Structure and function of the neurologic system. And you know most of this from your days in anatomy when you were getting your nursing degrees. It's separated into two nervous systems: the central nervous system that includes the brain and spinal cord, and the peripheral nervous system that includes the cranial nerves, spinal nerves, and the pathways. Afferent or ascending pathways, and efferent or descending pathways. Now, this video you're not going to be able to see because I'm making this presentation into a YouTube video, but it's a really good video that goes over the basics of the nervous system that you may want to um, look at. Okay, so the peripheral nervous system includes the somatic nervous system, and motor and sensory pathways regulate voluntary motor control of skeletal muscles. It's bipolar. And the autonomic nervous system. We're very familiar with that. The sympathetic and the parasympathetic nervous system, that nervous system that promotes the fight or flight. Cells of the nervous system are called neurons, and they are variable in size and structure and have different constituents. Three components of a neuron is the cell body, dendrites, and axons. Axons carry nerve impulses away from the cell body, and they have a myelin sheath that covers them. It's an insulating substance that protects them, and that's one of the issues with some disease processes like multiple sclerosis. It causes a delineation of the myelin sheath. Nodes of Ranvier are regular interruptions of the myelin sheath. Saltatory conduction is the flow of ions between segments of myelin rather than along the entire length of the axon. Divergence is the ability of branching axons to influence many neurons, and convergence branches of numerous neurons converging on one neuron. So structural classifications are based on the number of processes extending from the cell body. And they're unipolar, pseudo-unipolar, bipolar, and multipolar. Different functional classifications are sensory, associational, motor. And here's a good diagram of the different components of the neuron. Neuroglia, it's the nerve glue. It supports the neurons of the central nervous system. And here's how that works. Nerve injury and regeneration. Wallerian degeneration is a degeneration of a nerve fiber that's been separated by injury or disease. Distal to the injury, swelling will appear, neurofilaments hypertrophy, myelin sheath shrinks and disintegrates, and the axon portion degenerates and disappears. Proximal to the injury, swelling and dispersal of the nissl substance, cell increases in metabolic activity, protein synthesis and mitochondrial activity. New terminal sprouts project from the proximal segment. The process is limited to myelinated axons, generally only in the peripheral nervous system, and it depends on the location, type of injury, inflammatory response, and scar tissue formation. This is one of the reasons after a injury, a sporting injury, a fall, a motor vehicle accident, that it is imperative to try and keep the patient immobile because movement can actually worsen the paralysis. Neurons generate and conduct electrical and chemical impulses by selectively changing the electrical potential of their plasma membranes and influencing other nearby neurons by the release of neurotransmitter. It's an all or none response, so it works or it doesn't work. Synapses are the regions between adjacent neurons, and impulses are transmitted across the synapse by chemical and electrical conduction. Presynaptic neurons are proximal to the synapse, and postsynaptic neurons are distal to the synapse. There are more than 30 substances that are neurotransmitters: excitatory, inhibitory, synaptic boutons, and synaptic clef. Summation. Temporal summation is a single neuron, and spatial summation is multiple neurons. The central nervous system it consists of the forebrain, the midbrain, and the hindbrain. Reticular formation is a network of connected nuclei that regulate vital reflexes, like the cardiovascular and respiratory function. Together with the cerebral cortex is referred to as the reticular activating system. I wanted you to know that this is located in the occipital lobe. The forebrain consists of the telencephalon, cerebrum, gyri sulci and fissures, gray matter and white matter, Brodmann areas, lobes, cerebral nuclei. And this is the forebrain. And you can see here that I've listed the maintains homeostasis and instinctual behavior here. And the midbrain consists of these three segments. Whoop, missed one. Diencephalon has these three, or these four rather. The hindbrain, cerebellum, controls fine motor control, balance, and posture. The pons is a bridge. Myelencephalon, medulla oblongata. I remember learning that term when I was in nursing school, and I like to say it. The spinal cord lies within the vertebral canal and is protected by the vertebral column. So it's like that's there's a hole down the center of the spine, and that's protecting the spinal cord. Connects the brain and the body and conducts somatic and autonomic reflexes, provides motor pattern and control centers, and modulates sensory and motor function. Gray matter and white matter. You can see the difference here on this illustration. And here's the spinal cord, how it goes in the center of the spinal column. And here's another illustration of that. The reflex arc consists of a receptor, an afferent and efferent neuron effector. A reflex arc is the nerve pathway for the impulses that cause a reflex action. The pathway of a reflex arc. So that's one of the reasons when we're doing physical assessment, we check for reflexes. We're ensuring that that reflex arc is intact and there isn't anything impeding the flow. And this picture illustrates how If we hit if we use a hammer to hit the patellar tendon, that ligament, it causes an impulse from the nerve and it causes the leg to jump. Upper motor neurons are completely contained within the CNS, and they control fine motor movement and influence and modify spinal reflex arc. They're influenced, or they function with synapse and interneuron reactions. Lower motor neurons, neurons having direct influence on muscles. Cell bodies originate in the gray matter of the spinal cord, but their axons extend into the peripheral nervous system. And this is what that junction looks like. Different motor pathways here. And remember, I don't expect you to memorize anything that we're discussing today. This is just to give you an overview of the neurologic system. Sensory pathways. Protective structures. The cranium consists of 8 bones and it encloses and protects the brain and its associated structures. The glia aponeurotica is that thick fibrous band of tissue overlying the cranium between the frontal and occipital muscles, and this is added protection to the skull. If anyone's had the opportunity to see brain surgery, then you'll see this very thick fibrous band overlying the cranium. The meninges is a protective membrane surrounding the brain and the spinal cord. Cerebral spinal fluid and the ventricular system are also protective structures. Cerebral spinal fluid is a clear, colorless fluid similar to blood plasma and interstitial fluid. There's about 125 to 150 milliliters in ventricles, and it's produced by the choroid plexus in the lateral third and fourth ventricle, and it's reabsorbed by the arachnoid villi if they function properly. The vertebral column consists of 33 vertebrae, 7 cervical, 12 thoracic, 5 lumbar, 5 fused sacral, and 4 fused coccygeal. Intervertebral discs are nucleus pulpus. And those are the things when patients have herniated discs, when those are actually out of place and they can cause a great deal of pain and numbness because it's interfering with nerves. And here's a good illustration of the vertebral column. And this is what it looks like looking down on it. The blood supply to the brain, it's enormous, 800 to 1,000 milliliters per minute. And CO2 is the primary regulator for the central nervous system blood flow. The internal carotid and vertebral arteries and the arterial circle, or the circle of Willis. And this illustrates the blood supply to the brain. And the venous. The cerebral veins are classified as superficial and deep. They drain into the venous plexus and dural sinuses and eventually join the internal jugular veins at the base of the skull. So with a head injury, you want to avoid turning the head because it can interfere with that blood supply to the brain. The blood-brain barrier is cellular structures that selectively inhibit certain potentially harmful substances in the blood from entering the interstitial spaces of the brain. Implications for drug therapy, because certain types of antibiotics and chemotherapeutic drugs show a greater propensity than others for crossing this barrier. For example, some fluoroquinolones like Levaquin cross the blood-brain barrier, so patients are more likely to experience dizziness and a feeling of instability when they're taking that medication. The blood supply to the spinal cord comes through the vertebral arteries and the aorta. And this illustrates where that blood supply comes from. The peripheral nervous system consists of 31 pair of spinal nerves. The names correlate with the vertebral level from which they exit. They're mixed nerves and arise from the anterior and posterior horn cells of the spinal cord. There are 12 pairs of cranial nerves, sensory, motor, and mixed, and part of what you'll do as a nurse practitioner when we're doing examinations of patients is to ensure that the cranial nerves are intact. Fascicles are bundles of myelinated axons in the peripheral nervous system. They are called rami, plexuses, and dermatomes. And this illustrates all of those things we were just talking about with the nerves. These are the cranial nerves. I like this illustration. And the peripheral nervous system illustrated. The autonomic nervous system is located in both the central nervous system and the peripheral nervous system. It coordinates and maintains a steady state among the visceral organs. The neurons are preganglionic and postganglionic. There are two divisions of the autonomic nervous system, sympathetic and parasympathetic. Both systems function more or less at the same time. Neurotransmitters and neuroreceptors of the autonomic nervous system, sympathetic preganglionic fibers like acetylcholine and cholinergic receptors, sympathetic postganglionic fibers, norepinephrine, and adrenergic receptors. Parasympathetic preganglionic and postganglionic fibers, acetylcholine, and cholinergic receptors. Sympathetic nervous system mobilizes energy stores for a time of need. It's that fight or flight response. A1 receptors cause an increase in the heart rate. The parasympathetic nervous system functions to conserve and restore the energy, the rest, and the tranquility response. Preganglionic neurons travel to ganglia close to the organs they innervate. The functions of the autonomic nervous system is to maintain a steady state in the internal environment. So the sympathetic and the parasympathetic nervous systems are opposing systems. One is fight, the other is flight. Aging causes a decrease in the number of neurons, brain weight and size, lipofuscin and neurofibrillary tangles, and a slowing of the neurologic responses. And this illustrates a cranial nerve evaluation. You'll be learning all of this when you move on to physical assessment class.